This is the third one of these that we've done. And the goal here is to kind of make everybody aware of some of the specific safety procedures that are in place and that we expect everybody to be following, and kind of addressing the shifts in modified services and as our shelter-in-place order countywide continues to be modified. So as part of the modified countywide shelter-in-place order, yes, we are going to record this so folks can view it if they weren't able to make the trainings, although I don't, okay, now it is being recorded, perfect. So for anybody that wasn't able to attend, they can listen to this afterwards. As part of the county's modified shelter-in-place orders, we were required to create site-specific protection plans. Those should all be in your facilities and were also sent to you via email. Please do take time to read the ones, especially for the facilities that you frequent. The site-specific protection plans, or the SPPs, are evolving, as is the way we learn about COVID-19 and how best to mitigate its spread. So I just kind of want to acknowledge that things are changing and appreciate everyone's flexibility, as well as appreciating all the great work that's been done by city staff over the past few months during this very unprecedented and challenging time. And really appreciate everyone stepping up into new roles and being flexible and staying safe, and really proud to be a member of San Rafael, and hope everybody else feels the same way. Along those lines, as we go through these updates, some of these are things that you individually should be doing, tips on how to keep safe spaces or work with colleagues. But fundamentally, everyone is a safety officer. Everyone does have a responsibility and an expectation to keep themselves safe, as well as communicating any risks with staff that can also be mitigated. I also just kind of want to remind everybody that while more modifications to the shelter-in-place orders across the Bay Area are happening, the risk is not gone. In fact, kind of as expected, we have seen increased cases, and just in the last few days, we had an additional 3 fatalities in Marin County due to COVID-19. So I don't want anybody to get a false sense of security as more things start to feel more normal. The disease is still very prevalent in our community. Testing is available, and we'll talk a little bit about that at the end, but just kind of a reminder that this is still here, and we've spent a lot of time over the last few months creating new good habits in terms of wearing face coverings and keeping physical distance, hygiene, sanitation practices, and it's going to be really important to maintain those habits as we move into these modifications and trying to kind of reestablish a new normal. So please don't fall back on kind of old behaviors just because maybe your environment starts to feel a little more familiar. So I've broken my comments kind of into 3 main categories, and we're going to start with kind of self and expectations of what you as an individual can and should be doing. And again, all of these are kind of outlined in the site-specific protection plan, but we also wanted to cover kind of in a more generic way citywide as well. Face coverings are required by the county health officer, as well as at the city. We're also making sure everybody is wearing those face coverings. They do need to cover your nose and mouth. There are exceptions for a medical need, and if you feel like you fit that, please work with your supervisor or HR to figure out kind of the best path forward. Make sure you are kind of treating those face coverings as though they've been exposed and are contaminated, so wash them frequently. Try not to touch them. Wash your hands or sanitize after removing or touching them. And I like to kind of encourage everybody to think about the masks and the face coverings as kind of a sign of respect and kindness for others. The real goal with those is to prevent any of your kind of mucous membranes, if you will, a sneeze or a cough, an allergy sneeze, right? Anything like that, from spreading that out into the air onto other folks or onto surfaces. And so if we all kind of can keep our germs, if you will, contained behind these face coverings, we can all be a lot safer and resume more normal activities quicker. But it is really important you're wearing them and wearing them properly. At this point, I believe everyone should have them, and they've all been distributed But anything, bandanas can work. There's a lot of homemade options out there. But please, face coverings are essential when you're out in the community or when you're outside your individual workspace. If you have a closed office, you don't need to wear your face covering in your office. But if you leave your office to go to the copier or go to the bathroom, you do need to put that on. Or if someone comes to talk to you, really encourage those doorway conversations, staying physically apart, but also wanting to use your face coverings at that time. If you work in a more open air atmosphere, you want to make sure we're keeping that physical distance, but you also need to you may need to keep your face covering on at all times. If you have any specific questions about your work environment, feel free to reach out to your supervisor or HR. Hand hygiene is really important, something that hopefully we've all been kind of reminded of how important it is to wash your hands for 20 seconds with soap and water. We're working on installing sanitizers stations at all the facilities. So really encourage you to get into good habits of washing your hands when you're entering facilities, sanitizing as you enter vehicles or after you've gone out and done an inspection or completed a job, but really focusing on keeping your hands clean. Self-screening, and we've been talking about this since the beginning, but we do not want folks coming to work if they're sick or if they're showing any kind of like new or uncommon symptoms that are related to COVID. And what I mean by new or uncommon is, and I'll just kind of on a personal note, I've received allergy shots for years and have not been able to get my shots for the past couple months. So my allergies are much worse than normal, but I can kind of recognize the difference there rather than the respiratory or the fever or some of the other symptoms. So please stay home if you're at all sick, or if anyone at home starts developing symptoms, reach out to your supervisor for some direction. We are working on some signage for every site, but essentially by coming to work, you're saying you are not sick or symptomatic. So we continue to want to emphasize folks to stay home if they're not feeling well. Gloves. If you are in a position where you need to be wearing gloves because you're sanitizing high-touch surfaces, or working in an environment that makes sense, please make sure you're using them correctly and removing and disposing of them properly. You want to take gloves off by treating them as basically a hazardous material. So curl one up, grab it in the other hand, and then kind of reach under the other glove, and you can create kind of a nice little sanitized bundle. If you're wearing the same pair of gloves all day, you probably shouldn't be wearing them in the first place because they're no different than your hands. And using, hand hygiene is going to be just as effective. We want to try to reserve those supplies, but certainly if you're, again, in a role where you're doing sanitation work, or like our library staff, as they're checking in books, they're putting on gloves, but then removing them and disposing of them correctly as they go about other surfaces. So hand hygiene is certainly the most essential thing. So please make sure you're doing that. And then I want to kind of reemphasize that while we're talking about all these modified services, and certainly a lot of folks on the call today have been kind of back in physical spaces doing a lot of the field work and things like that across the city. But when folks that can and have been working remote should continue to work remote unless there's a business need to do otherwise. So just yesterday, for example, library opened up curbside services. So a lot of our library staff are now physically back in the building because of a business need. We're not calling for a broad-based return to physical buildings unless there is a business need to do so. So if you can continue to work remote, please work with your supervisor to make sure that's the correct path forward. But as other folks come back, or as we increase our interactions with the public, we want to make sure everybody's safe and following our site-specific protection plans. In terms of interacting with others and your colleagues, please maintain that physical 6-foot distance. With face coverings and with distance, risk of transmission is actually pretty low. It's pretty much the best thing we can do to keep yourself, your family, and colleagues safe. If you're in an environment, the biggest risk is those long and close exposures. So what I mean by that is the idea of having a close in-person meeting or traveling, going on a road trip with someone that's outside your household. But if you're just in a position where you're kind of exchanging plans or library books or something quick, or you're having to talk to somebody out on the street, but if you can maintain that physical distance, your risk is pretty low. So please make sure you continue to do that. avoid meetings and we want to go remote like we're doing now as much as possible. If you do need to meet in person, please make sure you're doing so in a big enough space where everybody can maintain 6 feet and everyone is still wearing their face coverings. Consider outside meetings if the weather allows, and kind of everything we can do to minimize those interactions. Another great example I think Sylvia mentioned a few days ago was if we usually do plan checks or reviews in person, we might need to adjust some of those services so it's a drop off and a phone call consultation and then a pickup. So we're having minimal in-person interaction to minimize transmission risk. A lot of folks with COVID are asymptomatic, but can still spread it, and then it reaches our most vulnerable who have quite a difficult time with the virus. So please don't assume that you're healthy. I think one of the biggest mind shifts we can all do is if we all assume we have COVID, and we want to interact in a way that keeps everybody else around us safe. So continue to keep your germ pools small. So within our childcare, they've been really keeping small groups of children with the same students as an example. As we kind of see more things modified and more return to normalcy, it's still really important to keep small germ pools or cohorts. So the example I use is maybe you have a young child that is desperate for a playmate, and maybe you can make an agreement with another family that you guys are going to be, your kids are going to be exclusively can hang out together, but you're not going to go out and create other germ pools with other families. So you're still creating that small environment to limit exposure risk. Also, kind of in the way we interact with others, we want to minimize carpooling as much as we can, so we're not in the same vehicle with colleagues. If you are, you need to be wearing face coverings, and a great suggestion was made in terms of using the back seat, kind of catty corner, if you will, opposite the driver, so that you're still creating as much physical distance, keeping windows down and good air circulation, sanitizing, those kind of things. In terms of our physical workspaces, break rooms and kind of common areas like copy rooms or the copier are probably some of the biggest concern areas. We want to remove anything that's typically shared, so silverware, coffee cups, etc., from those spaces. Maybe every employee can kind of claim their set that they're going to use, wash, and then keep at their desk if you're physically working in the space. So we're minimizing kind of sharing of those types of things. For pens, we don't want to have a big group of like some pens out that are publicly available that a lot of different people are touching and using. If someone needs a pen to use a pen, we can create systems where those get sanitized in between uses and things like that. So kind of thinking through those high touch or high share environments. We're working, and I think in most cases it's been completed, to separate workspaces by at least 6 feet. In areas where that's not possible, we want to consider staggered shifts or potential other alterations. So if you can't, maybe you have a cube mate and you physically can't get more than 6 feet apart, but maybe you can work either morning and evening hours or alternate days so that you don't have to be near each other for extended periods of time. Everyone, and this is again kind of where being the safety officer, your own safety officer, sanitizing high touch surfaces often. So for one of the first things I do, I go into my office about once a week, sanitize all those surfaces, make sure I start kind of clean, and then frequently do that. When you're using shared spaces like the break room, taking that time after you've been in there to wipe down handles, microwave things you've touched, so that you're leaving it clean for the next person. So we want to make sure everyone kind of has a role in sanitizing those high used and high touch surfaces. Appointments are a big one. So if you need to interact with the public, please make sure you're doing that via appointment. That also gives you the opportunity to screen and ask them if they're healthy or if had anybody, had any symptoms. And you can also, again, limit those meetings in terms of length and where they are physically. Where necessary, and this doesn't apply to a ton of our workspaces, but we want to make sure we're putting in those space markers where lines may occur, similar to what you've seen at the grocery store or things like that, to remind people to stay far apart. The physical changes are ongoing. We've got sneeze guards ordered for some spaces. Some of those have been installed. Some of those are still being shipped. So you'll see some additional changes. I mentioned the sanitizer stations, things like that. But again, everyone kind of has a role to play here, in addition to our custodial staff who have been doing an awesome job with all that work and keeping all of our workspaces clean. You should have supplies in each one of your facilities. Work with your supervisor if you have questions. If you start running low or think you need something different, please reach out to the Emergency Operations Center, or have your supervisor do so that we can get that stuff to you. Even if you are somebody that normally would kind of refill or resupply those on your own with your own purchasing power, we do want to make sure all kind of COVID related sanitation items go through the Emergency Operations Center. One, so that we're getting bulk deals and things like that, but also because they're potentially eligible for some state or federal assistance reimbursement. So really important that all that gets tracked. So please work with our Emergency Operations Center and logistics team on that. So that's kind of the space summary. I want to touch quickly on testing. Testing is available to you as city staff and as folks that interact with the public. Certainly encouraged to get tested. At this point, not required. It is free. You don't need a doctor's referral at this point. If you're interested in getting tested, you can go to the county's COVID site. And there's two main sites that we'd ask you to use, and that's at the Civic Center and then in the canal. And you can just schedule an appointment and get tested. And you can also get tested often, especially if you're in a high interaction environment where you might be getting exposed or live with someone that is. You're certainly, and the county's really pushing to complete more and more tests and have more people get tested often. And that is just COVID-19 current status testing. Antibody testing is still not verified or trusted enough to make it worthwhile. So in the county, there's no antibody testing outside of some scientific research occurring because the results just aren't reliable at this point. When we're interacting with the public, we do want you to take reasonable measures to communicate that they should be wearing face coverings, that if you're going to spend more time fighting with somebody, asking them to put on a face covering, and I use the word fighting, obviously, not literally, that's probably more of a risk than if you would just ask them, they say, no, I'm not going to do it. Maybe they have a medical exemption. And so in that case, you can just offer alternative ways to provide the service. So if it's something like exchanging a library book or a building plan and you can just ask them to set it down and step away, and then you can go receive it when they've stepped away or something like that. So certainly ask, but if they kind of push back, we're not expecting anybody to turn into enforcement officers out there. But again, try to limit your kind of constant exposure to the public as much as possible. Obviously for childcare staff and things like that, they're with the kids all day and have a lot of other sanitation procedures in place, and the cohorts help minimize those exposures. So again, please keep your physical distance and find creative solutions that allow you to still offer our services to the residents safely for you and for them as well. If you have any concerns specifically about someone in your household, work with your supervisor or HR on a one-on-one basis about kind of your best step forward. If anyone in your household tests positive or becomes a person under investigation, we would ask that you isolate. And a person under investigation is someone that was symptomatic and was tested. And so while those results were coming in, we'd ask you to stay home. If they test negative, then you'd be cleared to return. If they tested positive, we'd probably have you wait a few more days to make sure that your test was going to be accurate, and then go ahead and get tested. It is totally plausible, and I just kind of want to emphasize this, that if you are worried someone in your household might be COVID positive, that you do not get the disease. Our public health officer was one of the first folks in the county to get COVID-19, and he's been very public about it, but he has a wife and 3 children who all live together, and his wife and youngest child did not get COVID and were tested multiple times despite caring for him and 2 of his children that did get it. So it is possible to create that safe space within your home. So if you're worried about someone you live with getting sick, please start isolating from them immediately, and then we can work on getting everybody that needs tested. So kind of my closing comments, and then we'll open it up to questions. Everyone, again, has that personal responsibility and the ability to hold other folks accountable. So please make sure you're wearing your face coverings, practice good hygiene, sanitizing, and keeping those physical distances as much as possible. Make that messaging part of your routine meetings and your routine interactions and kind of reminders. as well as the mental health self-care in addition to the physical self-care and needs. We are still only coming back into physical buildings on a need basis. If you've already been physically back to work, you're probably set to continue that, but just want to make sure you're aware of the site-specific plans and that everything's being followed. If you need additional supplies, again, let our EOC team know. These are evolving as you have been part of for the last couple months. Every week or two, there's modifications to the shelter-in-place order and things shift. And so we'll do our best to keep you updated and continue evolving our best practices and things to meet your need. Certainly welcome to your feedback. Love to hear kind of things that you figured out that have worked for you, or ways you've found creative solutions you found to keep in touch while also staying physically distant. And just want to close before we take questions with, again, thanking everyone for your flexibility and your dedication and your focus on safety during all these challenging times. There's been a lot of really incredible work done that's been kind of in the name of continuing city services, as well as really expanding how we serve our community, whether that's food distribution or childcare to emergency workers, or a million things that I can't all list. So just my sincere thanks. I've been through a lot of different types of disasters. This is probably my first global pandemic, and it's been really inspiring to see what everybody's done. So thank you. With that, I will open it up to questions. If you're on the phone and muted, it's *6 to unmute. If you want to put a question in the chat, or if you're on Teams, you can just unmute yourself, and we'll address those. Like I said, Sylvia with HR is on the call. Sylvia, do you have anything you want to add, or how you'd like people to tell you they were on the training?
Yeah, no, I just wanted to add that if anybody is calling, like in a group, if you're listening as a group, if you could just email me and let me know who all the people were that were listening on the same phone line or in the same room, that would be helpful.
Thanks. Does anybody have any questions, or did we get it all covered?
Quinn, I was writing down questions as you were talking, but as you kept going, you answered all the questions that I had.
Third time's the charm, right?
Wayne, this is Corey. I do have a question, and great job. So great. Yeah, I answered all my questions before I needed to ask them. But just a clarification, the orders for outdoors and wearing masks, like when you're riding your bike or walking, were always to carry them with you. Is there a slight change then for us as employees? Is that what you're saying? Like, for instance, if I go out into Boyd Park, have my lunch and there's nobody there, do I wear my mask, or do I kind of keep it in my pocket, and if somebody comes in the park, I put it on?
Yeah, I think your second option there, if you're, not near folks and you can be unmasked, I think that's certainly fine. I think in general, anyone that's in a very kind of pub, if you were in a uniform or a shirt that said San Rafael, just kind of consider what that might look like to the community, and certainly might want to wear a mask a little more than the particular guidance. But in general, that kind of example, you're totally fine to unmask to eat lunch alone in the park, which sounds really nice.
Yeah.
When back to normal hours? So I have no idea. I'm not even going to pretend to sugarcoat that. So it seems like we're in kind of a 2-week rotation of modifications to the shelter-in-place order. So far, they've been trending in the loosening direction, but certainly the public health officer in the state reserve the ability and the right to make them more strict if we see surges. A lot of what's happened over the past couple months is a lot of healthcare planning and surge planning, and planning to be sure we could isolate folks that became COVID positive. So the good news is, while we have seen increased cases, our hospital system is able to handle them. Certainly, if that started to change, I would expect some reversals to the modifications. But at this point, kind of every 2 weeks, and part of that is with a 14-day incubation period, you make modifications. You can look at kind of cases that happen over the next 2 weeks, see if there was any significant spike because of those changes, and then adjust accordingly. And some things we are seeing roll out a little quicker than that. I think this weekend we might see modifications for worship services, but we'll see if they get those out. So I don't imagine being back to normal operations this month. I think a lot of things are going to be modified, but for folks that can work remotely, I don't think you should be planning on a 5-day office work week in the shortcoming, and that could totally change. Anything else?
Hi, Queen. This is Sarah from Finance.
Hey, Sarah.
Hey, I just have a question. With because I know like with the COVID, but then there's also like the risk of protests going on right now. So I don't know how that is affecting all the COVID, like the things that we're doing. So I was wondering if you know something about it.
Yeah, so it's certainly a concern. Most of the protests and certainly the march that's happening tonight, masks and face coverings are certainly encouraged, and trying to keep them as physically distanced as possible. I know in some parts of the country, and I wouldn't be surprised if that happens here soon, but anybody that's been to a large gathering is being encouraged to get tested for COVID. So again, if you're one of those folks, the testing is available to you, and we'd encourage you to take advantage of it. The science and the data, I think over the next couple of weeks, we'll see, but there's certainly an indication that we would see some spikes in COVID following all these larger gatherings in the coming weeks.
Mm-hmm. Okay. Yeah, that's what I wanted to know, because I didn't know how it was gonna play out, and if it was gonna make the situation worse.
I don't know if anyone knows, but certainly if we reverse logic that, in the sense that our cases were increasing and then we stopped being around each other and we were able to slow the spread, then the inverse logic would apply. But again, a lot of those folks have been wearing coverings, and so time will tell. Unfortunately, I don't have a better answer there.
Yeah, thank you.
That's a good point. I have a quick follow-up on that. So for instance, you go to the march tonight, how long before you should get a test? I mean, if you get a test right away, is that too soon? Did you wait a day or two, or how would you even know what's the right timing?
Yeah, so with an incubation period of 14 days, it's totally possible that you could test negative and then test positive in 14 days. And, whether you'd ever be able to know exactly where your exposure came from is also the challenge. But in general, I think they're saying 2 to 4 days after exposure to wait to make sure it's called viral load, to make sure your viral load is high enough to indicate on a positive test. Dr. Willis he does videos every day. Dr. Willis is our public health officer, and a few weeks ago he did one specifically about how the virus spreads, and like how many particles per sneeze versus per, just regular breath kind of a thing. But if you went to the march tonight, I would think something like, I would not get tested before Monday, would be kind of my gut.
Awesome, thanks.
Hey, Quinn, this is Becky. I have a question for you.
Sure.
So this is in regards to the free testing for us as employees.
Mhm.
What if one of my kids is showing symptoms? Is this available to them since they live with me, or is it just us?
No, yeah, really, it's available to anybody.
Right.
We're just really, they're encouraging public staff. So if one of your kids is concerned, you can definitely get them tested.
Okay, cool.
Yeah, and you can, for the Civic Center, I believe you call to schedule the appointment, and for the one in the canal, I think you can do it online. But those both link off of the COVID's website, and I can find that real quick, I'll put it in chat. If not, if you just go to the county's COVID site, it's there.
Yep, easy enough. Hopefully I don't have to make that call. Thank you.
And everyone's of course still welcome to go through their healthcare providers, but if that's a challenge for any reason, or the timing of it's tricky, the testing is open. So the Civic Center, I think, has slightly quicker results for anyone that's in a hurry.
Hey, real quick too, you can go after 1 p.m. To the canal. They accept walk-ins to get tested.
Appreciate that. Thank you. All right. Well, thanks everybody for joining. These are recorded. Sylvia, I'm not sure how you'll distribute those to folks that might not have been able to make these. And again, if you have any specific or personal questions, feel free to reach out to HR or your supervisor. I'm also available, but probably don't know as much about personnel issues as HR or your supervisor could help out. So, all
Thank
right.
you, Quinn.
Yeah. Thanks everybody. Have a great afternoon.
You too. Thank you.